Every day, acute care and ambulatory surgery centers face challenges on how to lower healthcare-associated infections. But with a limited number of instruments, tight turnaround schedules, and decreasing budgets, many facilities are performing flash sterilization in a misguided effort to sterilize items quickly to avoid buying additional surgical instruments. The fact is, flash sterilization, now known as immediate use steam sterilization, has been implicated in increasing a patient's risk for infection. This is why professionals who perform immediate use steam sterilization must become aware of the new multi-agency position paper that aims to improve poor practices regarding its use.
Most of us that work in healthcare are familiar with the term flash sterilization. It's been around for a very long time, and it was used to denote an emergency situation where unwrapped instruments were placed into the sterilizer on a standard cycle with a very short dry time in order to turn the instruments and get them quickly back to the operating room. The term flash sterilization is no longer used and has been replaced with the term immediate use steam sterilization. And immediate use steam sterilization is denoted as a process that's used only in emergencies and only if the devices that are to be sterilized are compatible with that process.
Immediate use also implies that there is no terminally sterilized item available for immediate use, and there is no time to wait for a terminally sterilized item. The sterilized item is used during the procedure for which it was sterilized. The item is sterilized and retrieved for use in a way that minimizes its exposure to air and other environmental contaminants. And the sterilized item is intended for immediate use and is not stored for future procedures nor held from one case to another.
The reason that it's not looked upon as a good solution is because oftentimes in the time frame, the tight time frame that we use, there's chances that corners may be cut, that during that rush process to get the instrument turned around, there could be processes and protocols that are missed completely or at least not fully complied with.
Immediate use steam sterilization exposes each item to direct steam contact at the required temperature and pressure for the specified time. There are three types of immediate use steam sterilization. Gravity displacement uses gravity in the conditioning phase to displace air and replace with steam. It does not typically include a drying time. Dynamic air removal sterilizers remove air from the chamber using a mechanical system. When used for immediate use steam sterilization, drying time is reduced. The two types of dynamic air removal sterilizers include high-speed pre-vacuum and steam flush pressure pulsing process. The third type of immediate use steam sterilization is the express, a just-in-time process with no shelf life. Regardless of the type, if you are called upon to utilize an immediate use steam sterilizer, then you must remember the following rules. It is vital that immediate use steam sterilization be utilized in accordance with professional guidelines, your facility's policies and procedures, as well as in strict compliance with validated written instructions provided by device manufacturers, sterilization equipment manufacturers, and container or textile manufacturers. This is especially critical for short sterilization cycles, as it takes time for steam to penetrate a sterilizer load and achieve an acceptable sterility assurance level.
On rare occasions, the manufacturer's instructions for the instrument, for the container that it's packaged in, and for the sterilizer that it will be sterilized in are not compatible, and they may say different things. When that happens, it's important to go back to the manufacturers to receive additional guidance to find out how to handle it. If you need the instrument right away, follow the instrument manufacturer's guidelines for sterilization.
There are certain devices that should never receive immediate use steam sterilization. Be aware that some instruments may be terminally sterilized but are not approved for immediate use sterilization, so always check the device manufacturer's written instructions. Instruments that have been used on patients who may have Creutzfeldt-Jakob disease should never be processed using immediate-use steam sterilization. And never sterilize devices that are sold sterile and intended for single use only.
The AORN, AAMI, and the CDC do not recommend the immediate use steam sterilization of implants. However, in a documented emergency, you may have no other choice. In that case, it is important, and in fact it is required, to ensure that the manufacturer of the implant has validated those implants for immediate use steam sterilization, and you must also ensure that you document and monitor the load in accordance with the latest guidelines.
When it comes to actually using the immediate use steam sterilizer, make sure the sterilization process takes place in a clean environment. Ensure that the sterilizer is functioning properly by testing it with a biological monitor weekly, preferably daily, according to policy. Quality assurance testing and routine preventative maintenance should be documented. Let's highlight the important steps in using immediate use steam sterilization by performing an immediate use steam sterilization cycle. To begin, the item should be disassembled and thoroughly cleaned to remove soil, blood, body fats, and other substances. This process is absolutely essential and should take place in a dedicated dirty area and never in a scrub or hand sink. Be sure to follow all the required processing steps suggested by the device manufacturer for either manual or mechanical cleaning and for the selection of detergent or enzymatic cleaners. Place clean items in a rigid, closed sterilization container or tray designed and labeled for immediate use steam sterilization in a manner that allows steam to contact all instrument surfaces. Rigid containers will also protect sterilized items during transport to point of use, as well as facilitate ease of presentation into the sterile field. For express sterilization, use packaging recommended by the sterilizer manufacturer, such as single-ply, non-woven wrappers that are compatible with the process. In order to verify sterilization and ensure compliance with monitoring standards, be sure to use the correct process challenge devices, or PCDs. Use chemical and biological indicators as required. For example, a Class 5 CI should be used within each sterilizer container or tray for gravity displacement and dynamic air removal sterilizers. Follow the device manufacturer's written instructions on the specific method of sterilization, including cycle type, exposure times, temperature settings, and drying times, and periodically review the instructions for any updates. Remember that cycle parameters vary according to sterilizer type, and that monitoring of each sterilization cycle is essential. Indication of failure will require the device to be reprocessed and an investigation into the reason for the failure. Wear hot gloves when removing items from the sterilizer. To avoid contamination, handle an open tray with sterile gloves, or use sterile towels as pot holders when removing hot items. Never place the container or tray on a non-sterile surface. Instead, place a sterile, impervious drape on a surface separate from the sterile field to open and remove items.
When an instrument comes out of an immediate use steam sterilization process, it's incredibly hot, over 200 degrees Fahrenheit. That instrument is then going to be placed directly into the OR and used in a patient procedure. It's important to ensure that those instruments are cooled properly so that the patient doesn't receive burns from the hot instruments.
Sterilization records should maintain accurate, detailed information on each load, including the load number, the contents of the lot or load, including quantity and a specific description of the item, such as type of instrument, the reason for immediate use steam sterilization, the patient receiving the item, the name or initials of the operator, the cycle parameters, such as exposure time and temperature, if not provided on the sterilizer printout, the date and time the cycle was run, the results of biological testing, if applicable, and any reports of inconclusive or non-responsive CIs found in the load. The time and temperature recording chart, printer, or tape should also be dated and maintained. Immediate use steam sterilization should only be used in select clinical situations and in a controlled manner. It should not be a routine practice. The important thing to remember is that if used, immediate use steam sterilization must follow standards, guidelines, best practices, and manufacturer instructions. Do not put your patients or your facility at risk. Know what's required and do it every single time.